I was born in Baghdad, but I came with my parents when I was 13 to New York, went to high school there, and after that I went to Columbia College in New York, then went to University of Miami for medical school. I also did a PhD in biochemistry. I always wanted to go into science, but when I was doing my rotations in medical school, surgery kind of was the most fascinating thing for me, and I came to Bluefield to practice orthopedics with a specialty in joint replacement surgery. I did have several opportunities to go into big cities, but when I talked to my wife about it, in fact, she went and visited Bluefield before I did, and bought a home before I did, so she loved it as well. I met my wife when I was in New York, and she was in the science field as well. We sort of liked each other and dated each other for a while. My daughter went to Vanderbilt and she was a cheerleader for 4 years. My son is in Richmond studying to be an OB/GYN. My daughter is finishing up her last year of residency in emergency medicine at University of Pennsylvania. And she's going to Harvard next year for a one-year fellowship, so they did really well. We like to travel. I like going to Europe, France, Italy. I like going to national parks here. Right now, very fortunate to have done my pilot instrument training, so I do like to use my plane and travel. Most patients that come to our office are complaining of joint aches or trauma. Shoulder problems is very, very common. Hip and knee problems are foot problems. We're using surgical techniques that reduce the amount of dissection and reduce the amount of muscle cuts that you need to do, which expedite recovery. And pretty much 100% of my patients go home the next day. Some of them go home the same day. I was able to convince the administration of the hospital to invest in new technology. With the robotic accuracy, we're able to balance the knee, for example, in all degrees of motion. It allows us to go from 95% accuracy to 99% accuracy. A lady came in with just a carpal tunnel and she said, I haven't felt this good for 2 years. It was a simple 10-minute operation. I just want them to feel like they're going to be taken care of. I think that to me is the most positive thing you can portray.